to NeuroNation Physical Therapy and Wellness. My name is Chloe, and today we're going to explore the different types of atypical Parkinson's conditions. These conditions share some similarities with Parkinson's disease, but have distinct characteristics and treatment approaches. Let's dive in and learn more about these unique conditions. Atypical Parkinsonism refers to a group of neurologic disorders that have symptoms similar to Parkinson's disease, such as tremors, stiffness, and slow movements, but also include additional symptoms and different underlying causes. These conditions often progress more rapidly and respond differently to treatments compared to classic Parkinson's disease. The first condition we'll discuss is multiple systems atrophy, or MSA. MSA is a rare neurodegenerative disorder that affects multiple systems in the body, including the autonomic nervous system, which controls functions like blood pressure and digestion. MSA can lead to symptoms such as severe blood pressure fluctuations, problems with bladder control, and coordination issues. Next, we have progressive supranuclear palsy, or PSP. PSP is characterized by difficulties with balance, eye movements, and swallowing. One of the hallmark signs of PSP is trouble with voluntary eye movements, leading to difficulties in looking up or down. This condition also often causes stiffness and rigidity, particularly in the neck and the upper body. Corticobasal degeneration, or CBD, is another atypical Parkinson's condition. CBD affects the cerebral cortex and basal ganglia, leading to severe movement and cognitive challenges. Symptoms can include limb stiffness, difficulty with coordinated movements, and cognitive impairments such as problems with speech and understanding language. Lewy body dementia, or LBD, is a condition that combines symptoms of both Parkinson's disease and dementia. It is characterized by the presence of Lewy bodies in the brain. Symptoms include fluctuating levels of alertness, visual hallucinations, and problems with movement similar to Parkinson's disease. Cognitive decline is also a major feature of Lewy body dementia. Now that we've talked about the four different types of atypical Parkinsonism, we're going to discuss the differences and similarities between atypical Parkinsonism and Parkinson's disease. Starting with Parkinson's disease, this condition progresses slower. One side of the body shows symptoms first, then progresses to both sides of the body. Falls are less common early in the disease. Parkinson's disease responds well to levodopa medications. Resting tremors and leaning forward are common in Parkinson's disease. Now, moving on to atypical Parkinsonism. These conditions tend to progress faster. Falling is more common earlier in the disease. They show less response to levodopa medications. Falling backwards is common in PSP and MSA. Autonomic dysfunction is more severe in MSA. Visual changes are common in PSP. Acting out dreams are common in MSA and LBD. Visual hallucinations and changes in intention are common in LBD. Myoclonus, which is twitching or involuntary muscle movements. Alien limb syndrome, which is a hand but sometimes a leg moves involuntary and people may not recognize their hand as their own. And ideomotor apraxia, which is the inability to carry out on command learned motor acts despite having adequate motor and sensory abilities, such as brushing your teeth or using a hammer. Those last three are all very common in CBD. Now, for the similarities in the two conditions, balance problems, they're both progressive in nature, limb rigidity, tremors, which are common but not in all atypical Parkinsonisms, bradykinesia, which is slowed movements, emotional changes, cognitive changes, and autonomic dysfunction, such as changes to the bowel, bladder, and or blood pressure, are very common in both conditions. It is important to understand that atypical Parkinsonism conditions get diagnosed incorrectly as Parkinson's disease. Early and accurate diagnosis is crucial for managing these conditions effectively and improving quality of life. Managing atypical Parkinson's conditions require a multidisciplinary approach. This includes working with neurologists, physical therapists, occupational therapists, and speech therapists. A personalized treatment plan can help manage symptoms, maintain mobility, and enhance overall well-being. Thank you for watching, and if you found these videos helpful, please like this video, subscribe to our channel, and share it with others who might benefit. For more personalized care, visit our website or give us a call. Let's work together towards better mobility and independence.